everybody. Thanks for being here. I'm happy to be here to talk to you guys about such an important subject that unfortunately affects so many people. Healthcare really isn't my subject. I focus more on foreign policy and war and peace issues, but I've kind of been forced to speak about this now. So in learning about this, I see there's so many different statistics that are always cited to kind of give us some sense of how bad the situation is here in the U.S., how serious the crisis is. One that recently kind of shocked me was from a study from the Urban Institute. It said there were 27,000 preventable deaths in the U.S. every year due to lack of health care. And I just thought this is something that I think most Americans would think could never happen here, that we would never let the system get that dysfunctional. But here we are. And I realize too that statistics only go so far in giving us a sense of really how bad it is. For the rest, I think we need to tell our personal stories to kind of put a face on the horrors of the status quo. And that's why I'm here to tell a bit of my story. As someone with a chronic illness, I spent most of my life living here in the U.S., but also a period living in Europe, so I could kind of personally compare how I was treated by two different systems. So hopefully this will shed some light on what millions of people are going through here and how the system really treats, or more often than not, mistreats people. I have cystic fibrosis, which is a pretty serious genetic disease that affects primarily the digestive system and the respiratory system. So my genetic defect makes it so that my lungs create more mucus and it's thicker than it should be. And therefore I'm more prone to catching lung-based diseases, flu, pneumonia, things that you guys would probably be able to fight off maybe fairly easily by staying in bed for a week. I'd have to go to the hospital with IVs, and it would be a really serious ordeal, and it can really actually be life-threatening for me. So to treat this, I have to take a lot of medicines, a lot of breathing treatments. About 2 hours a day, I do breathing treatments, an hour at night and an hour in the morning. And thankfully, there's been huge advances in what I have since I've been born, medicine-wise, and I've been able to thankfully take advantage of that. But even with all the advances, life expectancy for someone with what I have is still not even 40 years old. So I think it was 37 or 38 years, the last statistic I saw. So it's a really serious disease. It's also very rare. There's only about 30,000 cases in the U.S., which in business terms means that the medicines that I have to take are extremely expensive because they're made for a very limited market. So when I was renewing my Medicaid application just a few weeks ago, I calculated that last year my medicines cost over $70,000. And that had gone from $10,000 since last year. So every year it goes up, which makes me a huge boon for the insurance industry, or for the pharmaceutical industry, rather. I'm kind of their best case scenario. Like she was saying, I think they look at me, they're excited when they see me. And I'm also a huge nightmare and kind of the worst case scenario for any insurance company because I show no profit potential. As long as I have this disease, which will probably be the rest of my life, I will never make $1 from an insurance company. And this is the case for anybody with any kind of a chronic illness. So I, in essence, pit these two powerful industries against each other. The insurance industry and the drug industry. And that creates constant tension, which I think often can lead to a deadlock, which means leaving the patient, everyday folks, out in the cold. And this is really what happened with me this last year in November when I switched companies trying to see a specialist for what I have. I switched to a company called Neighborhood Health Providers in New York, and they decided to play hardball with me and basically quickly deny one of my most expensive breathing treatments. It costs about $2,000 a month. So as I was trying to figure out, I hadn't been through this before, as I was trying to figure out what to do, what was the cause for the holdup, I began making phone calls to the doctor, to the insurance company, And I began to see that in their eyes, through the eyes of the corporation, I kind of lost my value in terms of my humanity. I wasn't seen as having kind of intrinsic value, but seen more as kind of potential dollar signs, as either an asset or a liability in business terms. And I began to feel like the price of life could actually be calculated, and that the price of my life was too expensive. So the company started basically doing everything it could to not pay up. And I also began to see the nature of bureaucracy and how it played a real fundamental role as a problem for the system. And that it was actually, I believe, intentional. I think it's kind of similar to how bureaucracy plays anywhere, including the military, for example, which could maybe lead good, decent people to do pretty bad things, because you can always push off the responsibility onto somebody else. It's never maybe your fault. And that's how I felt when I was talking to people on the phone at this insurance company. They never really showed any real emotion as to any sympathy with what I was going through. And could always say, well, talk to so-and-so. And I spent so much time on the phone. So, they read through these excuses that I feel they have just sitting in front of them. From the fact they told me that my medicine wasn't on their list of approved medicines. This is a pretty common thing to have formularies with medicines they approve and what they don't. I was told that I needed to show more clinical proof that I needed this medicine, that I needed to find test results to show that I actually benefited from taking this, which I don't have, and I've never had, and I can't get on a short-term basis, and I was running out of medicine within days. So it really put me in a fix. And they also said that just the review of my request would take 72 hours. And that wouldn't guarantee that I would get it, but 72 hours I would have to wait just to hear back something. And it didn't matter that I had been on this medicine my whole life, since it was invented. That basically the standard for anybody who has CF to be on this medicine, this is so typical. They're trying to find ways to get out of it. So when it got really bad, I had spent literally 4 days on the phone from the moment I woke up till their office closed, pushing people, trying to get somebody to do something to give me my medicine. And once we got past one hurdle, there was another and another and another, and it just seemed kind of endless. And I even made the financial argument that if I don't get this medicine, I'm going to have to go to the hospital really quickly. And that's going to be vastly more expensive for you guys. So it's in your financial interest to approve my medicine. And even that didn't seem to work. So I ended up talking to a friend of mine who's a lawyer who actually focuses on the death penalty. And he said that he was going to try to help me when we put some legal pressure on the company to pay up. But before I could take him up on that offer, I got a call the next morning from a representative of the company saying, your medicine has been approved by the medical director, no explanation. All that extensive documentation they were requesting wasn't necessary in the end, like they were saying. It was just trying to make it difficult for me. And I really felt they were testing me to see how much of a fight I would put up for medicine. And that's the sense that I got in talking to other people about their own stories, was that that's the nature of the system. They want to make it so complicated and difficult that you give up and you stop even asking for it. I've been waiting 2 weeks and I'm fed up with this. And if I don't hear a response by the end of the day, I'm going to do something about this lawyer. And there was a complete 180 in how the company treated me. I was that person again. And I started seeing periodic phone calls. Don't worry, we'll get to you by the end of the day. And it was just this thing where I actually felt horrible, like I had value. But at the same time, it was because of this legal threat and So by the end of the day, my medicine was approved, and I felt relieved, but at the same time I realized the privilege and the advantage that I have to resolve the problem that most people on Medicaid don't have, because Medicaid is for the poor, and I was thinking about the immigrant maybe who doesn't speak English very well. There's no way in hell they would be able to understand complex explanations for what I had to do and what the reasons were to take minor medicines on the phone. This would not be possible. I had a really hard time following their logic. Also, anybody raising kids or having 2 jobs, or there's no way to spend 4 days at home all day long pushing these companies to do something. It's just not possible. Also, I had free legal help, which most people don't have. So I had all these benefits that people don't. I also, one thing that also kind of frustrates me with the system, but also gives me hope, is that a few years ago I lived in Spain for about a year and a half. I was studying there, and I got to experience a different system. Basically, I went to the local hospital, filled out paperwork for 10 to 15 minutes, and then I could go every month, pick up my whole batch of medicines, same name brand prescriptions, and the government footed about 9/10 of the bill. So it left me with a small, manageable portion that really didn't cause me a lot of headaches or constant worries like I have here. And it's important to know that when I was there, I had a student visa. I wasn't a citizen. I wasn't paying taxes even into the government, but they just had different priorities. One being taking care of people, and it really put me at ease. So I think also the good news is that the majority of people here pull show that they want change. They want fundamental change in the system. So we already have that with us. But we still have a lot of work to do, I think, because hold on one second. We have a lot of work to do because people don't really understand the solution either. I also saw a poll that 2/3 of people actually still somehow, I think, bought into the kind of propaganda that socialized medicine was kind of evil or nationalized healthcare was evil. They actually still believe that corporations could do a better job at delivering healthcare than the government could. So we have a lot of work to do in terms of educating the public on actually what the right solution is, and I think this bill here would be really important. Also, one thing that's promoted, I think, is Medicare for all. And I'm on Medicaid, so I don't understand the complexities of all the systems. But for me, at least, I still have to go through, like I said, private companies. And I think as long as these private companies, I had a choice of 5 or 6 different companies, as long as you have to go through a company, there's going to be problems because there's the profit motive, and they have a financial interest in denying medicines. So I think we really need to make sure that whatever we push really truly has the insurance companies out of the picture. Unfortunately, also, I think both parties still aren't really talking about these fundamental changes. Even Obama, who I think has kind of captured the imagination of so many progressives, is only talking about tweaking the system, and really leaving the insurance companies still in the picture, which would keep profit still centered to our flawed system, which will ensure that people will not be treated humanely in the end. So I think one of the most powerful things we can do is share our stories, like what we're doing here, what I'm trying to do when I tell my story. There's power in that, but there's also, I think more importantly, power in what we do with our stories. And I think we need to take this sentiment, this public opinion that is already with us, and turn it into concrete action, into a movement that's going to put pressure on those in power to do something, to do the right thing. I think it's kind of similar to where we're at with Iraq, actually. The public opinion is already with us. They want withdrawal, but we haven't figured out how to mobilize people to put pressure to actually get that done. So I think, unfortunately, historically, this has only happened. The government really bows to the will of the people especially when it requires going against a lobby or a real powerful business interest when there's a crisis at hand, and when they realize that business as usual just can't go on. And I think we need to make that crisis. I really am a firm believer in nonviolent action and civil disobedience, and I think that that's going to play a crucial role in kind of stepping up pressure on politicians. One thing that I've been really impressed with was the California Nurses Association. They were featured in the Bill Moyer's show a couple of weeks ago, and they were showing pictures of their actions against Schwarzenegger, and it was so impressive. They were saying they couldn't go out in public without being hounded by this group every step that he went. And I think we need to do that on a much broader scale, statewide, federal, government. But we need to not let this go until we get what we're asking for. So I think we've ceded too much to the corporations, and we're never deciding what treatments we get, what medicines we get. We've given them too much, and we need to start to take that back. Thank you.
His life's as least as valuable as Dick Cheney's, isn't it? Yeah? Yeah. I think so. I want to mention 3 things to you before I forget. I want you to, if you'd like, look at American Patients United, which is a patients union set up to fight for healthcare reform. You can find us on the web, and we're launching lots of actions in the future and working to reform the system. I'm also part of an organization that's not very radical, but they're more radical than the Democratic Party. The Progressive Dems of America have a healthcare not warfare campaign, so I'll lay some of this out here for you too. Also on June the 19th, there's a nationwide protest of the health insurance industry going on. There's a group called AHIP, which is the American Health Insurance Plan, that's gathering in San Francisco during that week. 38,000 healthcare administrators, healthcare insurance administrators will be in San Francisco, CEOs and accountants and all those people who decide how much Eric's life is worth and how much my husband's life is worth are going to be there, and we're going to be there protesting. A number of groups, about 20 different groups in California have come together to put on this protest. It'll be at 4th and Howard, for those of you who get to San Francisco at noon, on Thursday, June the 19th. But if you'll go to the guaranteedhealthcare.org website, guaranteedhealthcare.org, and if you Google Guaranteed Healthcare, you can get there. You'll also find a flyer that will tell you about other actions taking place that same day in other locations around the country, so that you can find a place to protest the American health insurance industry should you choose to do so. And that's a part of the process that Eric's so right about. We've got to be in their faces all the time and telling them we are not prophets, we are patients. The next panelist I'm going to introduce, I'm going to let her close our program, and then we'll all stay around if you'd like to ask questions or discuss. We'll all be here. So it's such an honor to introduce who has become a sister to me, who was unknown to me a little over a year ago. Reggie Cervantes now lives in Oklahoma City. She was a resident of New York when the World Trade Center collapsed. Reggie is a volunteer. She's a volunteer worker. And she raced down to Ground Zero to help that day. That day when we were all plastered in front of televisions all over this country watching and wondering what we could do and what was happening and how could we help, Reggie and her fellow workers were there. And the volunteers were there not because they were getting paid, just because it's what they're trained to do. I was having an argument a couple of weeks ago with somebody about healthcare reform, and I at least got them to agree that these folks deserve health care. I mean, that's such a basic to me. These were the people who raced where we would not and did what we would not and put themselves at risk. And I said to that person, the scary thing for me is, through all that we've denied to them, all the care we've denied, they still would race in for us and put themselves at risk and have great disease and trauma. So it's my honor to introduce Reggie. I love her, and I know you will too.
I'm Reggie. On 9/11, I responded to the World Trade Center. I'm 48. I grew up in New York City. I became an emergency medical technician after working for the heart surgeons at Cornell and calling up people to collect money for their heart surgery. And people like Donna's husband, when we see them coming, we hear ka-ching, ka-ching. But I wanted something a little more gratifying. I'd done CPR before, I was a lifeguard, and I decided, well, I'm going to become an EMT because I think helping people on a personal level, on a one-to-one, is going to give me a little more personal satisfaction. And I was a trauma junkie from the word go. I have 7 cardiac life saves. That means I performed CPR 7 times and got my patients live after they got to the hospital, which is phenomenal for somebody who only had 9 years in EMS. I did it as a volunteer because that's what I was told to do. I did everything I was supposed to do. I had a job, I had an education, I performed community service because that was the right thing to do. That's how I was raised. So on 9/11, while standing outside a school during primary election day, handing out leaflets for a local young woman who wanted to be a city councilwoman to make improvements in our community in terms of education and everything else, I got phone calls, pages saying there was a mass casualty incident downtown, and I ran home the 2 blocks, got in my uniform, got my jump bag, and responded. I arrived at ground zero just as the second building had collapsed. The first casualty I removed was that of Bob Michael Judge from the church at St. Peter's. And we put him in an ambulance and sent him to the morgue. He had been placed in the church by a firefighter, bunch of guys who picked him up on the side of the street, where he was killed by a jumper while giving last rites to a fallen person. And my life from that moment on has been transformed. Those are my kids. I'm standing here today because I will not leave a legacy of no action of a disaster. I'm not leaving them with what I inherited in our society because it's wrong. And my motto is, I will not go gently into that good night. I would not go silently into that good night. My husband jokes that when they're closing the coffin, I'll be opening it up and saying, wait, you didn't hear this. And that's most likely what will happen. While we've been here in this enormous think tank this weekend, I found that yesterday's events all related to my situation. Homelessness, I've encountered a great deal of incidents in my colleagues' home life situation because of domestic violence stemming from the lack of health care and resources for losing their job because they responded to a disaster to help people. The Iraq War, the economic ramifications subsequent to the depression the war created, and I met a lovely young man, Max, who talked about the source of popular submission, the media, and I'm disenfranchised from the media because we can't get our message through the mainstream because they're controlled by the Viagra ads. It is more important that we continue this culture of who can take the most Viagra and get the biggest deal. That's more important on the news than it is about what's going on in America. But it takes a village to raise a child, and it's going to take a village to solve this issue. So I'm going to tell you that everywhere I speak, I find out about local disasters. That's my husband, and that's our family. And my kids have been very resilient. They have, like me, post-traumatic stress disorder because while I was down there, the nanny and my neighbor in my apartment late at night, when I hadn't gotten home, decided that maybe the kids can spot me on the TV. And for hours, the disaster you saw on TV, my children watched, looking for their mother, hearing repeatedly, "Mommy probably died in those towers. What's Grandma's number?" And when you're 2 and 4, you don't know Grandma's number. didn't expect that the towers were going to fall. I didn't expect the disaster was going to be of that proportion. And I wrote to Michael when I heard about he was compiling a healthcare documentary about my horror story, about falling from upper middle class, educated, civilized society to being homeless and to begging, to finding myself alone in the middle of the country with people telling me, hey, get some personal responsibility. I had personal responsibility. That's what took me to ground zero on 9/11. And now, like 75,000 sick responders across the United States, I'm dying. I have pulmonary fibrosis. I have chronic obstructive pulmonary disease, gastroesophageal reflux disease, post-traumatic stress, and the rest I can't even remember. I have masses in my mouth that the first one I had removed at my own expense. It cost me over $600. And I have multiple masses now that I can't afford to have removed. And the bottom line is, I need to know what's in my mouth. I need to know what's in my body when it's there. These various lumps in my lips and in my mouth have shown up in other places. When I went to Cuba, I was pregnant. When I returned, I had a miscarriage. And it's not in the movie, but that's why I was sluggish and I was slow. But I'm determined, and with my last breath, I will make sure that my children will not inherit this disaster. That's the three of us. On the left, it's Bill Mayer, known as Billy Cigars. Billy lost his dad recently. That's me in the middle. And on the right is John Graham. And we speak out. Everywhere I go, this was at the Oklahoma Capitol. And there was a healthcare conference when Bush vetoed the S-chip bills, state-sponsored children health insurance. And that's my 11-year-old who spoke publicly, wrote her own speech, because she felt that how are parents who don't have access to health care going to stay healthy enough to keep their children well? And how are you going to take health care away from children when they need to be healthy and be productive members of society? And she handles the media really well. And like Donna, I have a little bit of a metamorphosis. You'll see me go through a great deal of changes in hair and weight. I donate my hair as often as I can. You need 10 inches. And I've donated my hair 3 times to Lots of Love in memory of those lost on September 11th. And I send in my donation, and I have this campaign, so I encourage you to tell people who have long hair that they should do so. I'll give you my email address, and I'll collect yours so I can send out a notice and letting you know when I'm doing these things. And basically, I could send you a list of names, and you pick one that might mean something to you for one reason or another, and you encourage people to donate their hair to Lots of Love. This is a man who's afflicted by the contaminants of 9/11. You see the skin and the little marks all over his skin. That's from being contaminated. He can't use his hands now. He was a building cleaner. He has no access to health care. He worked his entire life. He went down to help. That was his job, to clean buildings. And now he can't work. He can't feel his hands. I couldn't get a pulse on him. We had to go to Congress. These are my sick colleagues, U.S. Marshals, NYPD, police, Port Authority Police, EMS, Fire Department, housekeepers, residents of Lower Manhattan. I don't see myself as a hero. I see myself as a patriotic citizen who responded to a disaster on 9/11, and now I can't get help. These are my children right here in front, sitting with a little girl whose father's at war, and she wants them back. And we were discussing, it was a peace rally, discussing health care and the ramifications of the war. Notice in the parking lot, there's only one news vehicle. Now I'm going to tell you about one of the stories throughout the times that I've spoken that I learned. In January, I was approached by a professor at retired professor at Oklahoma State University. He was a professor of the bar, Ron Dubois, who asked me to come and show Sicko in Stillwater. And I did. This is their son, John. John was 48 years old earlier this year. John is a young man. John is a teen. This is John when he graduated from medical school. On his side is his mother, Laura, and on his other side is his dad, Ron. They're in their 80s. This is Ron as a doctor. On April 18th, I received this note. Reggie, I thought you would want to know. The tragedy is that John would have received a transplant long ago, except for insurance problem, or had he lived in another nation with universal health care. Getting the money delayed, we paid $5,000 out of pocket for a donor search. They spent the money finding a donor. Now it's too late. They denied John a bone marrow transplant. If you think this can't happen to you, Dr. John Dubois died at 48 years old because he was denied a bone marrow transplant by Gil Spar. I met John in January. This is how John died. He could have lived. He could have had a life. This is not the young man I met in January. He died a painful death. He died because he was denied health insurance access to a transplant. This is his dad, Ron, and I met him at the VA when he came in for treatment because he was a vet. And we discussed the Sicko movie and doing something about it. It can happen to anybody in our society. You could fall from being a middle class and upper middle class person because the control is in the hands of companies whose only interest is to make their CEO and CFO a fat cat. They don't care about us. The board members don't care about us. And the only way we're going to solve this is every one of you talks to your friends, moves another person to go to a healthcare rally, to write to your elected officials, to find out where these stories are in your neighborhoods, where you live, and to act. To vote responsibly, to go to voter registration drives at colleges and let them know what you think. I did one recently in a community college in my county. Then I got involved and I was asked to do a Sicko showing there. And my name and my email appeared in the newspaper as being a person in the movie who was going to show the Sicko movie. And I got death threats. And I had to get the county sheriff's office to stand outside because I was going to speak at a Democratic meeting a few weeks later. And the death threats have come in from time to time. Don't go there, we'll be waiting for you. Some obvious, some not so obvious. We're living in a country where the right is threatened, the people with power are threatened by the people who want to live in a democratic society. And unless we speak out, this will continue. When the suffering is personal and we act collectively, we can create change. But it's only going to happen if we act. If we sit at home and we just make a comment or two when we hear something on TV, nothing's going to happen. And when people tell me that I need to get some responsibility, some personal responsibility, that it's a matter of me getting off my ass and acting, I tell them, you are complicit in condemning any and all rescue workers to an early, painful, frightening death by your silence. And they look at me. And then I tell them some of the painful situations I've had. Sometimes A simple thing like getting the medicine for my gastroesophageal medicine seems like an obvious problem solver. But to the people who are in control of the whole healthcare mess, the people who have denied us access to healthcare from the city and the state because they told me in Oklahoma, that's a New York problem. You didn't get hurt in Oklahoma. Well, the 75,000 sick responders across the U.S. have health care issues in their communities. When our GERD, gastroesophageal reflux, acts up, sometimes we have painful bouts of abdominal pain, and the diarrhea is so bad it will burn the flesh off my cheeks when I go to the bathroom. The resolve for that is to get medicine. Medicine I don't have access to. Workers' comp won't pay, and I can't get. I can't buy on my income. I can't buy health insurance. And you have to act, and you have to talk to your friends to act, and we have to change this. Because anybody, this could happen to anybody. It happened to a 48-year-old doctor who has spent his life saving others. And this is what we're left in our country. And I beg you, get the movie, share it with people, go to places, registered voters, act, act, act. And remember, I will not go silently into that good night, and you shouldn't either. Thank you.
Do such a bad job if we picked for the movie, did he? Thank you all very much. We're all here to answer questions. Does anybody have a question I'd like to answer or ask to have everybody here? Do they have anything they want to know? Don't forget. Yeah, go ahead, sir.
I had a question about the Medicaid thing. Does that mean Medicaid farms out its management?
It does. Medicaid in many states farms out its management of the program to private, and it's happening in Medicare too. For those of you on Medicare with Advantage plans, I'm saying
that Medicaid model is basically what the Democratic campaigns are sort of proposing in a sense.
Well, in a sense, I mean, Hillary Clinton's campaign has her America's Choice plan, which I always find somewhat amusing. If you're forced to buy a private product, I'm not sure that's much choice, but she has a combination of mandated purchase of private health insurance, expansion of Medicare and Medicaid, and the possibility to buy into some of the government benefit programs. Barack Obama's is very similar, except that it does not have the mandates of purchase of insurance for every American. It mandates purchase of insurance for children. It does not mandate the purchase. It has some employer mandates in it that employers have to do some purchasing of insurance benefits for their employees as well. The problems with both of those plans, in my mind, is they include mandates. We have a state where mandates are in place right now, and that's Massachusetts. And I was there a couple of weeks ago for a truth hearing where people were talking about what those mandates are doing to them, and it's doing exactly what was predicted. Those families who can't afford better insurance buy catastrophic insurance. So it's all well and good if you don't get sick. If you get sick, you cannot afford the amount of money you have to out of pocket in order to get care. Now, the state also had in place in Massachusetts subsidies for those families who couldn't afford insurance. The state would subsidize the purchase of private health insurance. Now, how we get to the point where we subsidize corporations that way, I'm not sure. But anyway, the numbers of people requiring subsidy is so huge, it's really busting the budget in Massachusetts. So, for good or for not, I thank the people in Massachusetts and said, I'm sorry you're the guinea pigs and it's not working, but I'm also glad that we have a state where we're showing that mandating the purchase of health insurance will not work. I also have heard there was an article in the New York Times, or not the New York Times, the Los Angeles Times recently, where there are some constitutional challenges to the mandate of the purchase of private insurance. If you equate this to the purchase of car insurance, for instance, those of us who drive a car in most states are required to carry automobile insurance. The writer in the Los Angeles Times was publicizing that it's not the same though, because everybody has a choice on whether to own a car or not, on whether or not to be a private owner and therefore have to be compelled to buy insurance. None of us have a choice on whether or not we have a body that needs health care. So I think there will probably be some legal challenges to the mandates as well. But yes, I mean, all the Democratic plans have some expansion of Medicaid and Medicare. H.R. 676 has often been called an improved Medicare for all, because most of our doctors know there are some problems with Medicare too. I mean, it's vastly improved over any other private plan. But there are some reimbursement issues, and there are some issues that still need to be resolved with Medicare too.
Is there any program for working to educate the Democratic candidates?
Oh God, yes. We educate the Democratic candidates so much. And I don't mean to answer you in that way.
I'm talking about
The presidential ones. You mean the congressional folks? Oh yeah. We work really hard on talking with the candidates about. You should ask your candidates. Do you support? Would you be a co-sponsor? If I vote for you, would you co-sponsor HR 676? And if not, why not? Tell me what you do then. If it's not HR 676, then what is it? There's a bill in the Senate called the Healthy Americans Act. Be very wary of that. Anytime they start using language that sounds like marketing, it is marketing. Anytime it sounds like this, HR 676, you should probably look at it. It might not be marketing.
who's we, the PDA?
Oh, it's all, Healthcare Now is one of the organizations that does lots of educates. Healthcare Now is a completely single-payer advocacy group. PDA has a range of 7 issues that they push. PDA was really an offshoot of Move On movement. Those of you who know about Move On in politics, became basically another arm of the Democratic Party, helping Democrats who aren't very progressive at all, or very left of center. So PDA developed as a group that was truly trying to hold people to the fire on progressive issues. There's 7 issues they concentrate on. Good group, I like them. They're not far enough left on a lot of things. I personally don't object to the issue of socialized medicine. That's okay with me. But I don't often, in this crowd, I'm okay saying that. In some crowds, it's not okay to say that. It doesn't work well. I do a little bit of marketing myself, as you might imagine, so I have to gauge the crowds and what they're going to hear and what they're going to listen to. But yeah, there's enough. Physicians for a National Health Program does an enormous amount of educating of candidates. And these doctors, and you don't have to be a doctor to be a member of their group. I love that. You could be just us, and you could join, and it's not real expensive to join either. And they have great links to data and to research that's been done on the subject. They have awesome amounts of information on that site. So Physicians for a National Health Program.org, PNHP.org is their website. So that's another good one to go to. There's any number of groups that are trying to educate these. Getting to that critical mass of 100 is very difficult. Very, very difficult. Yes, sir.
I hear what you're saying. I'm a physician also, but you use the word colonoscopy.
Colonoscopy.
You use the word bone marrow transplant. You use the word cystic fibrosis and new medicine. It takes 20 to 25 years to get a product from research to where you get it. It takes to develop a bone marrow transplant process. It takes the cost of that to get it there. It takes tremendous education to educate a physician. He's a physician, I'm a physician. How much money did you spend to get us educated to take care of you? You see, tremendous. I don't hear the other aspects of health care at all. I don't think the patient there at the time, he wouldn't be alive 10 years, 15 years ago, because they didn't have the medicine he was taking. And they have new medicine now that he's not taking, probably, at least others. So what I'm saying is, if we're going to talk about health care, you bring the patient in, okay. But let's talk about all of it. Malpractice insurance, how much it costs. That costs quite a bit every year, 2 months' salary.
I think I would agree with you, and I think we are talking about those things. One of the things David Himmelstein, who's one of the co-founders of PNHP, talks about extensively is research. And the cost of research of all of these procedures, we, the taxpayers, we do pay that. Most of the clinical research is funded through the National Institute of Health.
Well, the education of her, all the costs of these things, That's all health care. It's not
Absolutely.
going into doctors.
Absolutely.
Treated. That's
And we do need to talk about the cost of medical education. There's no doubt about that.
Let's do a little bit more of it in talking like this, because it's a very one-sided discussion. I think I'm familiar with this side quite a lot every week, but I'd like to hear you discuss it.
And let me make a comment about malpractice if I can, okay? One of the things that we've noted, and PNHP has done a great number of studies on the malpractice issue as well, as you might imagine, it's a critical one for doctors. It costs them a lot of money. But where the big money damage awards come in medical malpractice is in future medical costs. That's where the big money comes in those awards. Under a single-payer system, you would remove the need for future medical cost awards in medical malpractice cases because everyone's medical care would be covered under the National Health Insurance Program. So you remove that portion of the damage award. When you take away that huge portion of the damage award, you lessen the trauma on the medical malpractice system. This is not to say we don't need some reform in that area anyway, but right now, no matter what, it still only represents 2% at most of what the problem is with our healthcare financing system right now, according to PNHP studies. So there is a great deal of research going. I certainly honor your request that we should talk more about those issues, but there is more going on with that as well.
I just wanted to say that on June 19th, there's going to be nationally, so if you research in your communities or you put your name on that email list, we'll send you where to look up, where there's a protest near you on health insurance. Another thing I wanted to say about part of the cost of rising health care is the expensive education you have to acquire to be a doctor. And in places like Norway and France and Cuba, you could go to school for free to be a doctor because they consider that part of the taxation system. Cuba also accepts 80 American students every year for free. There's some legislation now in Congress to try to prevent Americans from going to get an education there. The only thing the Cubans want, once you graduate for being, having been through their medical school and you become a doctor, is that you go out and you practice socialized medicine. Two of the young women that we met while we were at the hospital, one from Manhattan, who grew up not far from me, and one from California that somebody in the group just happened to recognize as being somebody's sister they knew in California, graduated after we left, and they're going to come out and practice socialized medicine. They're going to go and work in some poor community and work in a clinic because they don't have student loans. They didn't leave school owning a tremendous debt. They can work where their heart tells them to work for the people and not just for a profit-based system, having to charge people the going rate just so that they cover their malpractice insurance. So write your name down, your address, your email address, and I'll tell you where some of these events are going to take place.
And if you want to, let me know. I'll send it to you.
I'm really happy about medical developments that happened since I've been born, like I said. But at the same time, I just saw today, I was just reading that, the pharmaceutical industry made something like $49 billion in profits last year. So it's not like they're just scraping by to make fixes. They're making tons and tons and tons of money. So there's something wrong there, right? I think, $49 billion in profit. It's like the oil companies. There is something, you have to restrain some of these corporations. That's a huge problem, but I'm thankful for the research.
I didn't believe you said that. Probably you said that. I'm going to say I'm talking about health care. I hear a prejudicial health care for the patient too. I have no problem with that. But there's so much money. So much. 80% of people that come to my office don't need to see me. They can go to a nurse practitioner, they can go to a Cuban physician, get total good care. Same thing. How do I know which is the 20%? Which is the 20%? But that's the whole thing of a physician. If you train 78%, you 80%. agency. And it's so much more specialized now, it's becoming more specialized. Human physician could not work in Asian hospital and go 2-3 more years to training. There's no doubt about it.
They do. They come to this country.
Do you have training?
No, they come to this country and they do work in other places.
Do they work in hospitals?
They work in emergency rooms.
Cardiac surgery?
Absolutely.
Oh,
I went into an ambulance
Sorry.
and they had state-of-the-art equipment. State-of-the-art equipment. They're trained, I mean, they would have done bronchoscopy on me, but they couldn't because I was pregnant, so I had to wait. And when I came back, it took me an enormous amount of time and research and nobody wanted to see me. I've got the plague. I've got something that's totally the unknown. And none of the research facilities in the United States want to spend the amount of money and time because it's not going to be lucrative for them to find out what it is that these contaminants, these multiple carcinogens, building a block together have caused in our bodies because it's not profitable. And we need to change that.
I'm ready to discuss that as much as I would like to hear a balanced subject. I did, that's not.
So I'll take that up for a second here. With regard to the malpractice insurance, at least 10% of our healthcare costs are manufactured by doctors who are ordering stuff that we don't really need, but just because we're afraid we might miss something, and a lot of the angst and the selfishness, I think, that goes into practicing medicine comes about because of this fear complex of what's going to happen if I get sued. So that's, if you take off 10%, you've just given a whole lot more people their insurance. The second thing I want to mention is that part of the Prout approach is cooperatives on as many things as possible. And this is an area that I'm not expert in, but Garda Gista has written a very nice manifesto, if you like, on the use of, people getting together and making their own insurance companies. Rather than a profit-driven insurance company, it becomes a cooperative insurance company. And so that is one way of arranging payment. The whole thing about it is just creating a pool of people that the high risk and the low risk get together. And so I proffer this for your consideration. I have not personally done this, but it is a model that can work on a smaller scale than the National Health Program. Although it may be easier to push. There are states that have single-payer health programs that are being pushed. So that's another option. And the Prout option does not mandate a government sponsor. That's only one way to do it. There are other ways to do it on a smaller scale.
Anyone else have questions? Thank you all so much.